So welcome everyone to the Childhood Cancer International First Global Survivors Network webinar. Today we are also celebrating the Women's International Day. So welcome everyone to be here with us today. We welcome today some survivors from all over the globe, and we look forward to an interesting hour with 3 keynote speakers: a pediatric oncologist with a special interest in long-term survivorship, and also 2 survivors who will share their experience with us. So my name is Tiago Costa. I am a long-term childhood cancer survivor. I'm actively engaged in some initiatives focused on survivorship, quality of life of adolescent and young adult cancer projects as well. And I am actually actual patient advocate at Acreditar, that is a leading childhood cancer organization in Portugal. And I'm also a committee member of CCI Europe and an ambassador for the recently EU SurNet project. I advocate to improve some outcomes for childhood cancer patients across Europe. And today I am here with my co-host, that is Nikuli Bakutso. She is a long-term survivor of a germ cell tumor of the ovaries. And today she's a healthy and the mother of 2 children. She is the CEO of the Nelson Mandela Children's Hospital in Johannesburg, South Africa, and serves on the Childhood Cancer Foundations in South Africa's board. So, Nikuli, thank you very much for being here today with me. The floor is yours.
Thank you, Tiago, and happy International Women's Day to all the ladies that are here with us and the survivors and the parents who are joining us. So just a few housekeeping rules. You may have seen them earlier, but just to remind everybody that please remember that you can use the feature of translated captions to automatically translate the webinar speech in real time to your own language. Click on the Show Captions button at the bottom of your screen, or you will find it under More in the Zoom webinar app. Please enable the translation, select your speaking language, and select your caption language as well. Please note that today we're going to have some speakers who speak in Spanish. And so if you don't understand the language, please use the translated caption option. During the webinar, we'll have some fun and we'll do a few polls, and you please ask all the survivors to participate in the polls. You're also welcome to put any questions you may have under the chat, which is also found at the bottom of your screen during the Q&A section. So without further ado, I'd like to introduce and open the webinar formally to Rodney Wong. Rodney Wong is a parent of a cancer survivor. He sits on the board of CCI Childhood Cancer International as its president currently. He's also the current president of the Sarawak Cancer Children's Society. He co-founded Children Cancer Malaysia and is currently appointed as their honorary advisor. I'll give it to Rodney Wong for his message. Thank you.
Esteemed colleagues and friends, good morning, good afternoon, and good evening. A warm welcome to each and every one of you joining us for this significant webinar. I'm honored to be here as the president of Childhood Cancer International, an organization dedicated to improving the life of childhood cancer survivors and their families across the globe. Today, we come together under the banner of Childhood Cancer Survivor Network, or SurNet, a strategic initiative under Childhood Cancer International. SurNet represents a beacon of hope and support, providing a platform where survivors can share their experiences, connect with one another, and find the resources they need to navigate life beyond cancer. The topic of today's webinar holds special importance: the significance of fertility for childhood cancer survivors. Fertility is a critical aspect of life, and that can be profoundly impacted by cancer treatments. Understanding and addressing these challenges is essential to ensure survivors have the opportunity to fulfill the dreams of parenthood and can lead fulfilling life. Our esteemed speaker will share invaluable insights and knowledges on fertility preservation, the potential impact of cancer treatment on fertility, and also the options available for survivor. This discussion aims to empower you with the information needed to make informed decisions about your future. We invite all survivors to participate actively in this webinar. Your presence today is a testament of your resilience, and we are committed to supporting you every step of the way. This is an opportunity to learn, to share, and to connect with experts and fellow survivors who understand your journey. Please save the dates, March the 8th, 2025. This is not just a webinar, it is a gathering of a community united by a shared experience and a common goal to ensure that every childhood cancer survivor can look forward to a bright and healthy future. Thank you for being here today, and let us embark on this important conversation together. Thank you.
So after these important messages and words from Rodney, I have now the pleasure to introduce Sydney Chayonyu, who is a 20-year cancer survivor dedicated to transforming the cancer landscape and advocating for holistic childhood cancer care. He holds a bachelor's degree in international business and marketing and a master's in management and organizational development. And Sydney serves as the fundraising director of Hope for Cancer Kids in Kenya. And he's also a board member of the Kenyan Network of Cancer Organizations and Childhood Cancer International. He also contributes to Kenya's National Cancer Control Program as a member of the technical working groups for childhood cancer prevention, screening, and early detection. His mission is to create lasting social impact and improve outcomes for children and families affected by cancer. So, Sydney, in short, first of all, welcome as well. And in short, tell us why CCI started the Global Survivors Network and what do we hope to achieve?
Thank you very much, Tiago, for that introduction. First of all, I just want to recognize all the survivors who are with us today. And I want to say you are the inspiration behind what we are trying to achieve. Basically, this came out of a need that we recognized as Childhood Cancer International. We realized that survivorship is a very lonely journey. A lot of the time you find you go through your treatment, and immediately after your treatment, someone ticks a box and they release you into the world to start your life. But we also realize that there are very many challenges, long-term effects of treatment, whether it is reintegrating back into the society, and there are quite a lot of things that survivors needed assistance with. So the main aim of creating this group, as I said before, survivorship is a lonely journey, is to find a space where survivors can belong. Because at the end of the day, it's a very isolating thing to be a survivor because you might not find people close to you or people who you know that have gone through cancer. So initially, it's just a safe space where survivors can come together, be with each other, share ideas, share their experiences. And at the same time, what we want to do is raise awareness about childhood cancer survivorship and also provide those survivors with the knowledge they need to get through their survivorship journey. We also want to be able to address some of these global survivorship challenges and also to create a platform where we can inspire and support one another. In short, this group called SurNet, which is the Childhood Cancer International Survivor Network. SurNet is that space where you'll be able to go in as a survivor, find the resources you need, find the people you need to walk you through the journey, find out where you can get support. And basically, this is the very beginning of SurNet, and we appreciate all of you for being here. Aside from that, I would just want to introduce the team behind this so that you understand who's behind it and what we are doing. First of all, I'd like to say thank you, a very big thank you to Joao Braganza. a previous CCI president, because this is something that came to him. Survivorship is very strong to him. And he got a bunch of us survivors together, and we started talking about what do we need to do for survivors? Where are they? What are they doing? And, it is through that SurNet actually grew. So you've already heard about me. I'm a 20-year-old cancer survivor from Nairobi, Kenya. And next is Joao de Braganza, who is the past president of CCI, and is very passionate about this. We do have Adri Ladik from South Africa, and she serves on the network steering committee. She provides a supportive role. We have Adekemi Oyewusi from Lagos, Nigeria, a 25-year-old Burkitt lymphoma childhood cancer survivor. You've already heard about Tiago Costa, who is a long-term childhood cancer survivor from Portugal. We have Pablo Alad, a childhood cancer survivor from Chile. Carlos Frias from Guadalajara, Mexico, is an acute lymphoblastic leukemia survivor, ALL. Carmen Wong Montero from Costa Rica is a cancer advocate, researcher, and Hodgkin's lymphoma survivor. We do have Patrick Yip, who is an osteosarcoma survivor from Hong Kong. And finally, we have Preeti Pad from India, who is a retinoblastoma childhood cancer survivor. So I wanted to give you that to paint a picture that we are trying to figure out what we want to do, how we are going to support survivors. And we have representations from across the globe, all the different continents, all the different regions. So you wanted a team that would be able to actually encompass survivors from different regions, from different areas that have different challenges. So with that, I just wanted to introduce you to the steering committee for the Global Childhood Cancer Survivors Network called SurNet. Thank you very much, and back to you, Tiago.
Thank you very much, Sydney. And if you have any doubt, and or if you want to have more information about the SurNet, please visit the website of CCI for more information, or write us an email for survivors.cci.care and to become a member of this group. And let's see you soon. So now I think it's time for us to ask you our first question. So you can participate as well with us in this webinar. The question will appear for you as well. So first one is, as a survivor of childhood cancer, were you ever told about fertility issues as a possible long-term effect of the treatments? You may choose yes, no, or do not know. And we will give you some seconds for this one, for you to answer. And it's only for survivors, the question. And now we have the results already. So we have 48% that said no, that did not have this kind of information. And also 43% yes, 10% do not know. So we can proceed now. And I pass the microphone to Nicole.
Thank you, Tiago, and thank you for the poll. So I have the pleasure of introducing our next speaker, who is our keynote speaker. Her name is Dr. Anel van Zyl. She's the head of pediatric oncology here in South Africa at the Tygerberg Hospital, and also a lecturer at Stellenbosch University. Dr. van Zyl was awarded her PhD for her research on the medical and psychological late effects of childhood cancer survivors in South Africa. She developed an appropriate long-term follow-up program for childhood cancer survivors in South Africa and will implement it with the South African Alliance for Pediatric Hematology and Oncology, SAPO members, in the near future. Dr. van Zyl is also the coordinator of SIOP Africa Late Effects Working Group and a member of several national and international working groups, and participates in several research projects. She obtained her M.Ed in Pediatrics cum laude from Stellenbosch University, her FCP's qualification in 2005, followed by her certificate in pediatric medical oncology in 2008. So I'd like to hand over to Dr. Van Zyl. Thank you.
Hello, everybody. Thank you so much. It's a pleasure being here. Just trying to share my screen. Okay, I hope everyone can see my screen.
Yes, thank you.
Okay, great. Let's jump right in. Right, so we are luckily have been for some time in the position to focus beyond the magic 5-year survival mark. We have started thinking about what comes after cure, as the true legacy of childhood cancer spans the entire life, someone said. We all know that the survival rate of childhood cancer has now luckily improved dramatically in the last few decades. But we also know that most childhood cancer survivors will develop at least one late effect sometime in their life. So what are late effects, in case you haven't heard of it? They are physical or psychosocial complications that develop after the cancer treatment. So what kind of late effects or complication can one develop? The first one is physical late effects, and of course one of them would be infertility, but any part of the body may be affected. And the severity of the complication is usually graded by using a classification that we call common terminology criteria of adverse events, and we grade it from a 1 to a 5, from mild to more severe. And these complications may develop very early after treatment, or sometimes up to decades, even up to 40 years later. And that's why you have to stay in long-term follow-up care. On the right-hand side, there are 2 resources in case you want to read further about late effects. The second group of late effects is psychosocial, which is really important as well. And they may develop at any point from diagnosis and include behavioral and adjustment problems, especially the teens, and mental health disorders such as depression, anxiety, and others, and also difficulty in socialization in the community and with friends and family. And as survivors get older and their life goals change and responsibilities, actually these psychosocial problems can increase. And the third thing that's really important is health-related quality of life, which we really want to optimize in all our survivors. So health-related quality of life is how your health status impacts on your physical and psychological well-being and also your social functioning. And usually people expect that survivors will have a poorer health-related quality of life than their healthy peers. And sometimes that is true for a certain group of survivors. But there are many publications that actually prove that survivors experience positive self-growth through their cancer journey and then report a better health-related quality of life than their healthy peers because they have been through a life-changing experience. Okay, we look at a few factors to determine who is at highest risk of developing late effects, and we look at treatment-related, patient-related factors, and then also what kind of cancer. I'm not going to go into details, but some of these listed are the ones that confer a higher risk of having late effects. Right, so now fertility problems. What is it and who is at risk? So luckily, it's not everybody. Some people think that if you've had chemo, it means that you will become infertile and take that for granted, but luckily that's not the truth. Females and males can be affected. And the definition of infertility is then the inability to achieve a pregnancy after 1 year of unprotected intercourse. And the risk of developing this may depend on what type of surgery was done, what chemotherapy drugs were used and how much, which part of the body was treated with radiotherapy, what age were you at when you were diagnosed, and what was your status of puberty at the time. So in females, when we refer to infertility, we usually call it primary ovarian insufficiency, the ovaries don't work, or premature ovarian failure, or premature menopause. And this causes infertility, but also can cause other health issues like osteoporosis and heart disease. And if you've had to have a hysterectomy, that can also cause infertility. The risk factors for females, there are many chemotherapy agents, but it depends on what dose you've needed to use. If you've had radiotherapy to the ovaries or the brain, if there was removal of one or both of the ovaries or the uterus, and if the girl was treated at an older age or while she was in puberty, there's a higher risk as well. Going on to males, so infertility is usually caused by a transient or then a prolonged abnormal sperm or an absent or low sperm count, and then ejaculation disorders may also lead to infertility. Again, there are many chemotherapy drugs, radiotherapy to the testis or brain, the removal of one or both testes, and if the boys were treated at more than 4 years of age, they are at higher risk. Now, if there are any healthcare professionals in the house, this is what we use to determine the specific individual risk of a patient to develop infertility and to decide who must be screened and how. So the International Guidelines Harmonization Group, they have brought out these 2 publications on the left-hand side for monitoring for male and female infertility. And on the right-hand side, they produce these easy-to-read tables. And using that, you can determine if someone has a low or a high risk and how you should monitor them and when you should intervene. So how do we monitor survivors for fertility problems? It should ideally be done in a long-term follow-up care program. For both females and males, we monitor growth, like the height, and also puberty development. We can test blood hormone levels if puberty doesn't progress as expected. For females, we monitor the menstrual cycle, and we may test ovarian reserves by doing a blood level of another hormone. For males, if they are old enough and they want to know, they can request a sperm analysis. So the strategy for all children who are about to receive cancer treatment is definitely a team approach. The doctor, the social worker, a psychologist if available, the nurse, and then also a gynecologist in this case, or a urologist. The team has to assess the individual's risk of infertility and then discuss this risk at diagnosis already, which is quite difficult because there's already a lot of information to share and after the shock of a cancer diagnosis. But before initiating therapy, it's important, if possible, and to discuss this with the child in an age and developmentally appropriate manner. One then also has to discuss what is possible for fertility preservation in your specific setting, if it's available and if it is possible to do in this case. So looking at females, the easiest thing to do is to just move the ovaries out of a radiotherapy field if radiotherapy is going to be directed to the abdomen. This will not help if you are receiving chemotherapy. It's an extra surgery with possible complications, but live births after this have been reported. The second thing is eggs can be harvested from the ovaries via a needle, but this can only be done in girls who have gone through puberty. Unfortunately, this will cause a delay in starting cancer treatment because stimulation therapy is required to actually produce the eggs. No live births after freezing of the eggs have been reported if that was done in females under 25 years. So these things are all expensive, they're specialized, they're not widely available. There are many ethical, cultural, religious considerations, and the benefits should outweigh the risks. The third thing that can be done, and this is in girls who are very young, even in infants, is that a piece of the ovary can be harvested through surgery and then frozen and reimplanted later after treatment. There have been live births reported. There is a concern of possible relapse of the cancer. In males, sperm can be obtained and frozen. This can only be done in post-pubertal boys through various ways, and live births have been documented. An experimental kind of procedure is for pre-pubertal boys to harvest a piece of the testes, freeze it, and reimplant it later, but there hasn't been any successful births following this. So why is fertility preservation key in survivorship? In a Stewart survey, 40% of survivors said that fertility was one of their health concerns. And these, if infertility is present, it may lead to emotional distress, anxiety, depression. It's part of identity for some people as a male or a female. It may cause relationship problems and have a significant impact on their health-related quality of life. Sorry. So just take-home messages. So fertility preservation is an increasingly important topic, but it is still a developing field, especially in low middle income countries. The individual infertility risk should be assessed and discussed at the time of diagnosis, and the feasibility of different options discussed in pre- and post-pubertal children. But it is unfortunately expensive and specialized and not widely available. There are sensitive ethical and cultural considerations to bear in mind, but fertility preservation could significantly improve the health-related quality of life of childhood cancer survivors, and that's why it's so important. Thank you.
Thank you very much, Dr. Anel, for this great presentation about this really important topic for survivors. Sometimes it's like we're running a marathon and this topic only appears after, sometimes some years after it, and maybe could appear before, and we think about it and have this kind of information before. Thank you very much for your sharing this knowledge. I just want to remind the survivors and also the people in the chat that you can to check the chat room and also all the informations that our team is putting there. And now I have the pleasure to announce and to welcome Pablo Allard, that is a 26-year-old psychologist from Chile with a certification in psycho-oncology. He is a childhood cancer survivor of a clear cell sarcoma of the kidney. And during his childhood, he lapsed 3 times with the bone marrow, brain, and thyroid. And nowadays, he is a co-founder of the Chilean National Network of Childhood Cancer Survivors, Luz de Esperanza. And he is currently working as a welfare and development coordinator of a housing facility for adolescents with cancer in Chile. He also participates in various projects and events related to these topics. So, Pablo, thank you very much for being here today with us. And I just want to ask you, in your experience, and how could the medical team help the long-term survivors who have more open discussions about their, for example, sexual self, body image, and fertility? What do you think?
Hello, thank you very much for the introduction, Tiago. So, well, this topic about fertility is such an important thing. I've seen it in my own experience, and I've seen it in my work with adolescents and the Chilean National Network of Survivors with adults with these problems. And I mean, most of the survivors doesn't know or are not aware of all the importance of this topic. I mean, sorry, can you repeat the question, Tiago?
Yes, of course. So, based on your experience, how could the medical team help the long-term survivors to have more open discussions about this topic in general? Yeah.
Because I mean, this is such an important thing, but most of survivors or patients doesn't know about this topic. I mean, when you're sick, when you have cancer, you undergo treatment and you survived, most of the, I mean, your main concern isn't fertility, it's to survive, is to be alive. So most of families leave or let this fertility topic behind. I mean, and it's important for the medical staff to continuously remind patients, to talk to them, to talk about this topic. So I think it's important for medical staff to continue and reminding and talk to this for patients.
Thank you, Pablo. And how do you think how important it is also for the childhood cancers survivors to speak with their partners when they have it about the possible fertility issues also, and about that this might happen in the future of the relationship? Yes.
Yeah,
What do you
I
think?
mean, for some people, talking about this topic of sexual life or fertility is something like they are sometimes afraid to talk about this. In my experience, sometimes I through my life, I've been like a little bit afraid of talking about these things. So it's important for us as a community, as survivors, to like change the mentality of that idea that is like talking about these things, that is maybe to bring back some memories from the past. I mean, or like talking about a topic that it's difficult for us to talk. So it's important for us like to change the mentality and just do it. Let's talk about it. Let's maybe look for help, psychological help, someone to guide us to talking about these things. So it's important to change the mentality of fertility and just go for it and talk, and that's it. For me, it has helped me a lot to.
Okay. I think you already answered a little bit of my next question, but do you have a message that we can share with young men, young survivors, cancer survivors, that for the post-treatment regarding their body image or their sexual self or life after the treatment?
I mean, I've seen it in the adolescents with I work childhood patients, adolescent patients, and with the survivors, more adult survivors. That, I mean, for them, they, as I already mentioned, they are sometimes afraid of talking about these things, this kind of having this kind of conversations, going to making like the exams or checkouts for fertility. I mean, for me, for a long time, I was afraid of making my fertility test. I mean, because of the radiation I received in my treatment, I have some difficulties with fertility. And I was afraid for so long to talk about this, to like assuming that it's part of my life. So my message for patients, survivors, for everyone is something that I already said, that let's talk about it. It's not a bad thing, this. It's important for us. It's part of our life. So let's change the mentality. Let's talk about this. Let's put it in the table and make it part of our life, because it's such an important thing for all of us.
Thank you, Paul. And now I will turn around the question. And what do you think would help in terms of the communication to the health professionals with the patients and with the survivors to make it easier to talk about this topic, and also to give resources or information about this topic?
Yeah, I mean, I'm going to talk about what I see in Chile, here in Latin America and Chile. So most of the medical staff, as I said before, don't talk that much about fertility issues. Most of families are not aware of what's going to happen in the future with his child, or I don't know. So it's important for medical staff maybe to prepare families from the beginning, like telling them what's going to happen, all the process, what it means, etc. Maybe preparing some material, some books, some, I don't know, something for explaining better for the families about what all of the process would be, and making them aware of what they're going to process, like not only fertility, in the whole treatment, I mean, life.
Okay. Thank you very much, Pavel. It was really nice to talk with you about this topic. And we now are going to
Thank you,
proceed
Thiago.
to another testimony. Thank you.
Thank you. Thank you very much, Tiago. Thank you, Pablo, for sharing your story. So I'd like to introduce our next survivor. Please remember to turn on your captions, show captions. As we said earlier, Vanessa is Spanish speaking, so if you do not understand Spanish, please turn on your captions so that it can be translated into the language that you understand while we have the conversation with her. So Vanessa is a 25-year-old young lady from Mexico. She was diagnosed with an ovarian dysgeminoma at the age of 12. For the past 5 years, Vanessa has dedicated her life to supporting children with cancer through her work, vocation, volunteering, and profession. Currently, she expanded her dedication to include children with life-threatening, life-limiting, and/or life-threatening illnesses in palliative care, as well as childhood cancer survivors. She's a nurse in the palliative care program of Konica Childhood Cancer Association that welcomed her when she was a patient. In addition, she's the co-founder of the Vanessa can see me and is on screen.
Yes, you're back.
Perfect, great. So I'm going to ask you a few questions depending on how much time we have, Vanessa. So can you tell us a little bit about the cancer treatment you received and what do you remember about your journey? Is she able to hear me?
Hola, hola a todos. Voy a intentar hablar un poco lento para que su traductor pueda captar lo que digo. Y pues primero que nada quiero agradecer que se creen espacios como este para que se comience a hacer conciencia sobre pues lo que vivimos los sobrevivientes. Y bueno, pues a los 12 años a mí me diagnosticaron un tumor en el ovario que estaba en una fase 3 de 5. Lo que más recuerdo de mi tratamiento fue la cirugía en la que me tuvieron que remover mi ovario junto con el tumor y también una parte de mi otro ovario, del ovario izquierdo, así como un poco de mi intestino, donde había hecho metástasis el cáncer. Y pues creo que en esos momentos lo más difícil o en un tiempo de cambios tan repentinos, parecía que toda mi vida iba a ser hospital y sentía que no tenía opción de elegir nada de lo que estaba pasando. Sentía que mis papás y los médicos eran quienes elegían por mí sin pensar en mi futuro, que se tomaban decisiones solo por salvar mi vida. Y pues lo que más recuerdo es que en ese momento yo solo tenía una decisión y era en qué perspectiva podía tomar de la vida. Así que siempre opté por tomar un positivismo y ver la vida de la mejor manera que pudiera, porque no podía hacer nada con lo que estaba pasando en mi vida.
Thank you. Yes. My next question is, two questions. Did you ever think you could be a mother? And how did you feel when you first became pregnant?
No, después de mi diagnóstico, se me impuso la idea de que no podría ser mamá. Pasé 12 años de mi vida repitiéndome a mí misma esta idea y convenciéndome incluso en algún momento de que yo no quería ser madre, pero realmente no era porque no quería, sino porque creía que de esta manera iba a ser menos doloroso hacerme a la idea de que no podría tener un bebé. Fueron 12 años muy difíciles en donde fue difícil aceptar y especialmente las relaciones sentimentales. Tuve que explicar que no podría ser mamá. Fui rechazada de algunas relaciones amorosas por no poder dar un hijo y fue algo muy difícil de asimilar. Y cuando comencé a estudiar enfermería, comencé a comprender realmente la dimensión de lo que estaba pasando en mi cuerpo y de las secuelas. Realmente hice conciencia de las razones por las que no podría ser mamá. Y más tarde, cuando escuché sobre la preservación, me dio mucha felicidad por quienes tendrán esta oportunidad, pero me dio mucha tristeza y frustración por mi historia, porque solo imaginé todas las noches que me pude haber ahorrado de sufrimiento y agonía, porque realmente mi sueño era ser madre.
All right. Thank you. Thank you. And what lessons from your cancer experience did you learn that you can pass on to your child?
Ujú. Mi legado para mi bebé, bueno, como ven en la foto, sí pude ser, sí pude ser mamá. Al final les voy a contar un poquito, pero sí tuve esta dicha de poder ser mamá, y lo que más le quiero transmitir a Nael es que lo que más deseo es la importancia de la resiliencia y de la fuerza interior. Quiero enseñarle que a pesar de que existan pruebas difíciles, siempre debe de mantener la esperanza y sobre todo el amor a la vida, la unión de la familia, porque creo que la unión familiar fue lo que a mí me ayudó más en mi proceso, y que siempre las pruebas pueden ser superadas con determinación y apoyo, que siempre hay esperanza en las circunstancias más difíciles, y que sepa que ante todo, pues su familia siempre va a estar unido apoyándolo en lo que más le haga feliz a él hacer.
Thank you. Very, very beautiful baby. I think that will be my last question in the interest of time. Thank you so much, Vanessa. I think now we'll move. Thank you so much. I think now we'll move on to if there are any questions on our Q&A with my co-host. If there are any questions I'd like us to answer. We'll just check, and please remember to just put in the chat box. But if there aren't, I can maybe take the liberty of asking Vanessa one last question. Is that okay? Tiago, co-host, is that
Yes.
okay? All right. Okay. So one last question for Vanessa. How has your experience with childhood cancer influenced your outlook on life and some of the decisions that you have made so far? Thank you.
Sin duda alguna, el cáncer cambió mi vida y fue lo que me hizo tomar la decisión de dedicar mi vida a los niños con cáncer. Pero algo que más quisiera como compartirles que aprendí todo esto es que ser madre o padre no debería depender de un milagro o de un golpe de suerte. Creo que esto es algo en lo que tenemos mucho trabajo que hacer, y que el cáncer ya nos ha arrebatado muchas cosas. No podemos permitir que también siga arrebatando la posibilidad de construir familias para quienes desean construir una familia, que el poder ser papás o no sea una decisión y no una imposición por el diagnóstico que tuviste. Esto es lo que más ahora como adulta y como mamá he aprendido a través del cáncer.
Thank you. Gracias, Vanessa.
I would
Can I
like
hand over to Tiago?
Thank you very much, Vanessa, also. And I would like, based on two comments that were made on the chat box, to ask the survivors that had the possibility to and the availability to share the testimonies here today, and also to Dr. Anel, to ask them what is the importance of having a long-term follow-up appointment, follow-up consultation, so that we can, as survivors, talk about these issues, to improve also the communication of the late effects and the information about the late effects that may appear after the disease with our doctors. What do you think about this?
Sorry, Tiago, who do you want to answer?
The Pablo, Vanessa, or Dr. Ana?
Okay.
may
While I'm
comment on
unmuted, maybe I can share my 2 cents worth. I'm in awe of what the survivors on the call have achieved with their lives. It's really impressive. So long-term follow-up care, firstly, you were treated as a child and the discussions were mostly with your parents. And later on in adult life, some survivors don't even really understand what cancer they had. So everything needs to be re-explained and talked through from the beginning to understand. Because as I mentioned, some people think they are infertile, as Vanessa said, and then they find out they aren't actually, there are options. So it can relieve worries that you think is the truth, but it's not. And if something bothers you and there's something physically not right, that you don't ignore it, but actually go for the checkups, even though there's a lot of anxiety and anxiety about that. And just to know your risks and manage your health very well.
Also could also reduce the fear of the relapsing and to be informed of what, for example, health lifestyles you should do and what signals you should be aware of as well. Yeah, so thank you very much. Don't know if Pablo and Vanessa want to add something on it.
Sí, creo que sí es muy importante contar con un seguimiento porque en mi caso, como les comenté, lo descubrí hasta que comencé a estudiar. Incluso cuando me enteré que estaba embarazada fue porque creíamos que tenía una recaída, que teníamos un segundo cáncer, que tenía un segundo cáncer y en ese momento fue cuando todo se transformó y terminó siendo un bebé, pero es por ello que creo que es importante que los sobrevivientes tengamos un acompañamiento para poder guiarnos o estar orientados sobre todas las dudas que tenemos y nadie nos explicó.
Yeah, I want to add, like, as I already mentioned, like for me, for so many years, I was afraid of like making my exams of fertility, of talking about this with doctors and medical staff. But it's so important. I want to repeat it. Like, if you don't like, if you are afraid of talking about this, if you like are ashamed or whatever, you should look for help. I mean, there's a lot of people nowadays, psychologists and medical staff, that are open to talk about this, and you should totally look for help and someone who can help you like express yourself, how to communicate what you feel about these things. And it's such an important thing for me. It helped me a lot. It changed my life. So just look for help and be aware of the importance of these things.
Thank you very much, both of you.
Thank you, Pablo. So we have another question. I think this one is for Dr. Fansel specifically, from Lisbeth. She's a survivor of Hodgkin's lymphoma. She's had 47 chemotherapy sessions, 31 radiotherapies, 1 bone marrow transplant, and 32 doses of immunotherapy. She said that she's missed her period and she can no longer get pregnant. Is there any advice we can give her or where she should go? She hasn't said which country she's from. Thank you.
Yeah, thank you for that question. She's definitely been through a lot of treatment and came out on the other side. It is quite difficult to really say anything about the individual risk because, as I mentioned, it really depends. You have to go into fine detail to see what the chemotherapy agents were, how much was given, where exactly was the radiation sites. There are some blood tests that one can do, especially if you are not having a regular menstrual cycle. It is a warning sign, but one still needs to do the female hormone levels to see what they are they normal or not, and then go from there. So I would definitely suggest that you try and go back to where you were followed up or in your current long-term follow-up care program, share your concerns, and then the doctor can make a plan to do a holistic assessment based on your history, and then also refer you to a gynecology clinic to make a plan together. Because luckily these days there are a lot of options to start a family.
Maybe
Thank you,
can
Dr. Vincent.
yeah, thank you very much. To advance to another question that we have on the chat, that is directly to Vanessa. What technique did you use to be able to become a mother? And also, yes, so yeah, and also I wanted then to ask to Dr. Anne, that can be applied also to Vanessa and Pablo, where if there were some resources or kind of information that you based in your experience you read it or about it or see it somewhere on the internet or some brochures in the hospitals that you were treated or where you have your appointments, or where could the survivors have this kind of information if you have already know some resources?
Bueno,
First,
de
first
la
Vanessa.
pregunta
Yeah.
que hicieron, no usé ninguna técnica, por eso les comentaba que al final ser mamá no debería depender de un milagro, porque todo el mundo decía que mi bebé fue un milagro. Realmente cuando me acerqué con todo esto fue porque quería aprender sobre tratamientos posibles para poder ser mamá, pero realmente no fue nada más que solo sé que ese periodo cuidé mucho mi salud. Cuando supe y tenía la intención de convertirme en mamá, mejoré mucho los hábitos que había dejado de tener después de ser paciente, pero realmente no intenté ningún tratamiento.
Thank you, Vanessa. And about the resources, Pablo, Dr. Ana, what do you want to share with us?
Sorry, the resources for becoming a parent.
No, now another question. Resources about fertility, for example, or fertility preservation that you may already encounter on the hospital, some brochures. What do you have any kind of this for example, in your hospital, or Pablo and Vanessa in the hospitals where you were treated? It was easy to find this information, or did you look up for another websites or other resources on the internet, for example?
I mean, for me, like a specific website that I used for information, it's the St. Jude platform. They have like a special part in their webpage with all of like information of different topics. And there's one of fertility. I can maybe look for it and share it here in the chat. But it was really useful for me, like to read and to get more informed about that. I'm gonna look for it.
Thank you, Pablo. It's also very important that also survivors can now be also part of the reviewing of some brochures, new brochures or new information that is coming out. I have experienced recently also for the EGAG guideline group that Dr. Anel has presented to us. So it is very important to have the voice of the survivors on this kind of information to make even more the plain language on it. I know I passed to Nicole. I don't know if you have another question to ask.
No, I think we've almost run out of time. So we just wanted to do a quick poll. We have one last poll we want to do with all the survivors. And thank you everyone for staying with us. So the one poll that we want to do quickly now, the question is, so that we can plan the webinar to address your needs, please choose 3 areas where you need the most help with along your survivorship journey. So please choose 3 areas where you need the most help with along your survivorship journey. The poll question is up. And we'll reveal the results shortly. The results out? Not yet. The results are shown on the screen, and most of you have selected the area of mental health, the highest at 57%, and medical care transition between childhood and adulthood at 43%. And then the next area is education. Thank you so much for everyone who participated in our poll. I think that's the last from my side. Thank you, Tiago. Hand over to you now.
Yes, and just one very quick question as well. The next one for you to answer. We're not giving the results yet, but it will stay for you to answer. So the question is, would you like to join the SurNet? You can now answer it very quick because we're reaching the time of our webinar, but we can answer it. And now to end, I must let you all know that we are very thankful for being with us. And I'm going to give the word to João now, to giving the close remarks. I think you already know João. I'm going to present him again. So João is the immediate past president of Childhood Cancer International, CCI, and is still a board member. He is also the president of Acreditar, the Portuguese Association of Children with Cancer. And João is active now in setting up the Global Childhood Cancer Survivors Network, where he collaborates with the survivors from around the world, and he's from Portugal. And thank you for being here too, João. Yeah.
Thank you, Tiago. Good morning, good afternoon, and good evening. It is my pleasure to address a few words at the end of this very interesting and important webinar. This webinar is a sign of the importance of survival and survivors for Childhood Cancer International, as Rodney Wong mentioned at the beginning, but it is also the result of some people's will to create SurNet. SurNet is a strategic project for CCI. It was established in 2024, and it has already ambitious plans. Also in 2024, SIOP formed a survivorship network, a working group to address survivorship issues where Sydney represents us. On the other hand, a few days ago, we had a meeting with a WHO representative to discuss the issue of survivors in Africa. Those examples are only a small sign of this topic's relevance for CCI and its partners. Much has already been done on a local and regional level for survivors, but we wanted this project to be global. So this global project, SurNet, exists because of survivors, and it won't succeed without the survivors' participation. I wanted, therefore, to invite everyone to be part of SurNet, to ensure that no survivor, wherever he or she lives, feels alone. We want to ensure that in every country there is a structure, however small, to support local survivors. We want to know who and how many survivors exist, what they do, what challenges they face, what they need, and how we can help them. We want to create solutions to existing problems. Please follow us on our social platforms or email us, and we will get back to you. Before I finish, I would like to thank a few people. To those who attended the webinar on a Saturday, having so many people watching, around 80, is a sign of the interest of this topic. To the webinar speakers, especially Dr. Nel Van Zyl, but also Vanessa and Nkuli, who are already part of our community. To the members of the SurNet Steering Committee, who organized this webinar. Last but not the least, a very special thanks to Ellen, our CCI Global Administrator, for her dedication, availability, and competence. I wish you all a good weekend. Thank you for joining us. And back to you, Tiago.
Thank you very much for your work, João, and thank you very much for all the participants. We'll just ask you for one last thing, that is, if you want, of course, to turn on your cameras and we will take a picture of all together. It might take little time because we are in 3 different panels in the Zoom, but Ellen will take care of it. So anyone who wants to join.
And smile. Let us all smile. We're happy.
Thank you very much to everyone. Enjoy your Saturday.
Thank you.
Bye-bye.
Thank you,
Bye.
everyone. Bye-bye.
Thank you, everyone. Bye-bye.
Bye.
Bye.
Yeah, almost done.
What is myself? I said so. Mm-hmm. Now I said it. Then I just tell myself. Hello? Yeah, so the plain one are inside the post paper on so all time. So see inside, I put down the packet. Go ahead and packet. Yeah. Okay, I don't care. Tuesday, so what? Tuesday, I will go now. So
Can I please ask the host,
what I do?
let us stay all the participants in the webinar. Can I please ask, I don't know, Ellen, to shut down the session for those who are not part of the steering committee?
Okay. Sale na matia